Hello, Miss Smith. I understand that you have a wound on your leg, and I was just wanting to talk and discussion of that because there's several things that can affect uh, your wounds and ability to heal itself, and the things that we can do, I can do, that you can do, and us do together, and having that wound heal as best as it can. And one thing that I was going to address was circulation. Of course, we know circulation is the blood circulating in our body, and uh, um, that's very important because blood it transports, it carries oxygen, and so that's something that we need is oxygen in order to live and breathe. And so that's the same thing in the tissues in your body, and even in the wound that's on your leg. In order to have that healthy tissue start healing, it needs oxygen. So we need to make sure that we have the blood flow, that circulation to that area. And so as my role as a PT, my role, that's something I can do, is making sure that you're warmth. And so that might seem silly, but it's true, because when we're cold, our nervous system kicks in. We begin to shake, we tense up, and that decreases the blood flow, the circulation in your body. So one thing that you can take note of, and something I'm going to as I work with you, is making sure that you're in a warm environment. And if we're not in a warm environment, we can at least give you a blanket or something to keep you warm when I'm working with you, in order to make sure that we're having circulation to that wounded area. Another thing that we can also look at is relaxation, and being able to relax. We can use different self-relaxing techniques or deep breathing techniques, uh, because as I said before, like when you're not relaxed, when you're tensed up, your muscles are tightened up, and that also decreases circulation throughout your body. And also doing them deep breathing exercises will increase the oxygen levels in your blood, which also carries it down to your wound, so that can help uh, the healing process as well. And lastly, I understand that you're taking some pain medication, so uh, at the times you're taking your pain medication, I can try to work within my schedule and your schedule the peak times when you're in the least amount of pain, and that's when we can try to do our therapy. Or I can, when I'm having to clean out or work on your wound, put bandages on it so that you're most relaxed possible and pain-free as possible. With that being said, it goes back to being relaxed, not being tensed up, and that also increases the circulation to the area. And so if you have any questions or about what we discussed, uh, you feel free to ask me. But the biggest thing, like I said, is we're going to emphasize, as the other ones as well, but one thing we was going to discuss first and foremost was circulation, and not just circulation, but circulation to the wound on your leg.